Let's talk about fibroids and fertility. And the most question which we're getting from most of the patient want to know exactly what fibroids are. Now, fibroids are benign, non-cancerous tumor or growth of the muscle of the tissue in the uterus, also called myoma or leiomyoma. Those are two medical terms which are used. Fibroids are usually found around the body or in the body of the uterus, what we also call a womb. And as well, sometimes can be found in the cervix. Basically, there are three types of fibroids. Subserosal, which it means outer wall of the uterus, which contribute about 55% of the fibroids. Intramural, which means in the muscle of the uterus, that is about 40% of the fibroids. And submucosal, which means in the cavity where usually the pregnancy happens, and that can be around 5% of the fibroid we see. How common are fibroids? Fibroids are found in about 20% of all women of reproductive age. African women or Afro-American women contribute about 50 to 80% of fibroid found in this group, especially in the reproductive age group. The next question can be, can fibroids decrease fertility? Probably that's the most important question which we need to understand today. Approximately 5 to 10% of infertile women or women trying to conceive have fibroids. And the most important thing to look at these women is the size of the fibroid itself in measurements and the location, which determine whether the fibroid affect fertility. Those two factors, I need to stress the size of the fibroid and the location is very important. And those two factors do determine the fertility of a woman. How do fibroid cause fertility? That's also a very important question. There are several ways in which fibroid can reduce fertility. Cervical changes or distortion, uterine pressure, uterine changes, uterine obstruction, fallopian tube blockage, fallopian tube destruction, uterine cavity space occupying lesion if the pregnancy cannot be there. And the other important things that the fibroid can compete really with pregnancy by taking more blood flow, and we have less blood going to the pregnancy or even to the uterine cavity for pregnancy to get attached. What happened to fibroid during pregnancy? Yes, you can be pregnant with fibroids, but the question we still have to ask, how safe is pregnancy with fibroids? Then fibroids are found in about 2 to 12% of pregnant women who goes through pregnancy. And the problem which these fibroids can cause in pregnancy are as follows. The fibroids may cause fetal growth restriction. Fibroids may cause what is called placenta abruptio, which is placenta being removed from attachment inside the uterine cavity early, preterm delivery, cesarean section rate is very high to people with fibroids in pregnancy, and abnormal presentation like breech or malposition is very common in patients with fibroid. Last but not least, the most commonest, fibroid may cause miscarriages in pregnancy. Note well, if a woman has conceived and having fibroid, especially big fibroid, been removed before by surgery or any other way, it's very important to discuss with your surgeon that whether the delivery should be by cesarean section or not. However, it is very recommended if it's an intramural fibroid and big in size that cesarean section should be recommended. How can we treat fibroid before pregnancy? We can treat fibroid in many ways before pregnancy. The most reliable way is really to remove fibroid. That can be by laparotomy, that can be by laparoscopy, just to remove the fibroid and suture the womb. The other method is to control the growth of the fibroid by using birth control pill or injections. You can use intrauterine device as well to minimize bleeding if you've got fibroid, not really interested in removing them. The other method, you can use what you call gonadotrophin releasing hormone agents or agonists, which can reduce the size of fibroid. But remember, this is a temporary measure. Immediately the fibroid, the medication is stopped, then the fibroid tend to grow very fast. More recent advance in fibroid management is myolysis, which is actually electrosurgery just to block the blood to the fibroid or even destroy the fibroid itself by microwaves. Thank you.